There has been a lot of focus on fentanyl amid a rise in overdoses. Now, a new substance making its way into Vermont's drug supply, and it's an animal tranquilizer. It was among the substances police say involved in the death of an infant in Barre just a few months ago. ABC 22's Josh Morrill looks at what makes it particularly dangerous.
Vermont has faced a fentanyl crisis for years, but experts say a new substance, Xylazine, has found its way into the state's opioid supply and is having a deathly impact on Vermont drug users.
Since 2021, it was involved in 14% of our fatal opioid overdoses in 2021 and was involved in 24% of the overdose data that we have to date in 2022.
Xylazine is a large animal sedative that is commonly used on animals like cows and horses and is not FDA approved for human consumption. I spoke with Nicole Rao-Midigi, the substance misuse prevention manager at the Vermont Department of Health, and she says it's being found in all opioids and that the effects are similar.
It impacts individuals' ability to breathe, slows down the body, so it mimics many of the same symptoms.
Saeed Ahmed is the medical director of the Westridge Center, a clinic at the Rutland Regional Medical Center that provides medication-assisted treatment for people addicted to opioids. And while Bennington County has seen the highest increase, he said he has seen numbers rise in the Rutland area as well.
Shockingly, I would say that we started noticing that there are several patients, every other patient was positive for Xylazine. People were not aware. Unknowingly, they were using it. Their fentanyl or opioids or heroin was laced with Xylazine.
Ahmed also said that his clinic just started testing for the tranquilizer in September and that there is no current treatment for it. He mentioned that throughout the fentanyl crisis, there was some hope Narcan could aid someone going through an overdose, but that the opioid emergency treatment doesn't work on Xylazine users, which has frightened him for the future that could see an increase in the tranquilizer.
At least we had some hope that we were able to use antidote Narcan. We had naloxone. Here we are really kind of hopeless.
Opioids laced with Xylazine are often referred to as tranq dope on the street, and you may ask why it's desirable for users, and Ahmed said it's to enhance the effect of the substance.
Combined with a tranquilizer such like Xylazine, the effects become like threefold, fivefolds, like several folds higher than what we can imagine.
Midigi said it's hard to tell by an initial reaction if someone has Xylazine in their system, but skin necrosis is one way it could differ, according to Ahmed, and he urges users to seek assistance at his clinic. Josh Morrill, ABC 22 News.